Good morning everyone. Today we are going to talk about heart attack, its prevention, causes and treatment. Myself Dr. Sachin Hundekari, interventional cardiologist practicing at Elite Heart Clinic, Wakad, as well as Synergy Heart Institute, PCMC, Pune. So we want to know that what causes heart attack. As we know, heart is the only heart beating organ that is starting its work right from the birth, and it doesn't stop anyway in between. Even a transient cessation of the blood flow causes a heart attack or ischemia. So heart is the pump which pumps the blood throughout the body, and it gives oxygenated blood and nutrition to all the organs across the body. So whenever the patient is having heart blockages, then the blood supply to the heart is reduced. Heart is a muscular organ, and it gives nutrition to all part of body, but heart itself receives the blood from the three arteries, what we call coronary arteries. These coronary arteries give continuous blood supply to the heart because it is working tremendously and non-stop. So the blockages inside these vessels causes heart attack. So what are the causes of the blockages? As we know that heart is working continuously, the blood vessels supplying the heart can there can be blockages inside the heart. It is mainly because of high blood pressure and high cholesterol level. High blood pressure causes damage to the intimal layer, what we call the inner lining of the blood vessels. So high blood pressure causes the disruption of the endothelium, that is the inner lining of the blood vessels of the heart vessels, and then there is deposition of fat or cholesterol, which ultimately lead to adhesion of the small molecules like platelets, red blood cells and other fibrinogens that lead to formation of blood clot, and which ultimately causes clogging of the arteries, leading to what we call as heart attack. So what are the symptoms of heart attack? Many times we know that patient present with chest pain, which is typically on left side, which radiates to the left arm, neck, sometimes to the back. It is associated with nausea, vomiting, severe sweating, but not all the time these symptoms are there. Sometimes the symptoms are atypical, like few patients can present with vague uneasiness in the chest, few patients present with back pain, jaw pain, shoulder pain. So there are various atypical presentations. Many patients present with only breathlessness, or many will have only vague discomfort. So high index of suspicion is must whenever you experience unusual symptoms. Many patients go to gastroenterologist or has been prescribed antacid thinking it is a gas. Sometimes they feel it is anxiety or some vague uneasiness. That's why they go to some orthopedician or get an X-ray done because of shoulder pain. So the symptoms of heart attack are variable. So we should know that whenever there is unusual discomfort in the chest or on the back side, or whenever you feel there is dizziness, sweating or unusual symptoms, it is prudent to get some investigations done to diagnose the heart problem. So how we can proceed? Whenever you have some unusual symptoms, you have to proceed with some investigations. So the basic investigations in the diagnosis of heart attack is what we call ECG. What is ECG? ECG is nothing but it is an recording of the heart rhythm. So it will show some changes in the graph. When we plot, when we take that ECG, we can see that there is increase in decrease in the blood supply to the heart, or stoppage of the blood supply to the heart causing heart attack, acute heart attack. It can also give information about your heart rate and heart rhythm. So second important thing what we do after ECG, in some patients ECG can be normal, then we can do a 2D echo. 2D echo is nothing but it is an ultrasound of your heart. What ultrasound of the heart does, so it will give you idea about pumping of your heart. Sometimes because of the heart attack your heart is getting damaged, so heart pumping is reduced. Sometimes there is wall leakage, so that patient will experience breathlessness without chest pain. So in this tool will assist you in the diagnosis as well as the prognosis of the patient. Third important investigations what we do are the blood test. So in the blood test, troponins are the markers of the heart damage. Whenever there is heart attack, the heart muscle gets damaged and the enzymes are released from the muscle fibers, and that is released into the blood. So these markers can be detected into the blood even in the absence of significant ECG or changes in the 2D echo. So that is very important. So history, then ECG, 2D echo and blood test, they are very useful in to lead to you some diagnosis of heart attack.